Our mission at the Department of Health and Senior Services, Division of Senior and Disability Services, is simple. It's to support those who are aging or with disabilities to remain in their homes and communities in lieu of nursing facility placement. And that's what home and community-based services is all about.
Our services that we offer include things like personal care, homemaker chore type services. There's a number of wraparound services that we can give in order to allow that individual to remain in the community or their least restrictive setting.
So before we modernized our case management platform, it was a sort of hodgepodge of different systems that were built at different times throughout the history of the program to meet different needs.
The project really began because we had 5 siloed systems that our staff had to log into every single day just to have the information they needed to do their job. The pain points that led to this project was the amount of time staff was spending logging into multiple systems. It was taking up a lot of the time that they could be spending with our participants.
I'm thankful to be a member of the Department of Health and Senior Services here in Missouri because we put a great deal of emphasis on modernizing not only the way we collect, store, organize, and analyze our data, but the way that we process our workflows end to end, the way we improve our transparency to our customers, and the way that we present ourselves to the public when they need our assistance.
The client really needed a single solution that brought in all aspects of their business. Coming from a set of legacy applications that didn't communicate with each other, caused additional work, unnecessary data entry, etc., they were looking for a single application where all of their users could communicate and collaborate together. We were able to provide that in addition to some newer features such as document management, integrated reporting and analytics, and even a mobile application that they could use in the field.
Every agency's needs are different, so what we do to tailor the solution to meet the needs of DSDS is to really look and see what it is they do day to day in their operations, and then we configure the system to streamline those workflows. We build the system in small increments, validating that hand in hand with the agency throughout the project. We're really looking for short feedback loops.
I really enjoyed this project, just being able to jump in and identify the problems that we were having and come up with creative solutions together for how we could make things better for our folks.
I think the approach that VIP takes with the way that they manage their projects was really helpful. It was nice to implement things in a staged approach and see them start to come to life.
Of the 7 workflows we configured for the state of Missouri, by far the assessment workflow was the most complicated and complex. It involved capturing data from the field, assessors going into an individual's home. The results of the in-home assessment were then calculated, and the individual either qualified or didn't qualify for services. Once those services were identified, then there was an entire care planning process to ensure that the providers that could provide those services were matched in that user's county, and all of that had to be managed in that case management workflow end to end with many people, including supervisors, assessors, all working within that workflow together in a collaborative way.
The testing of the project has been a wonderful success. You know, we test in sprints, so we make a development, and then we have the opportunity to test it. And if something isn't quite right, we send it back, and they're always willing to make the adjustments that need to be made to make sure that it works for our folks.
According to Missouri's intake and referral team, they've seen a 30% increase in productivity, represented by the number of referrals that they can process on any given day. This allows them to intake and process applications right up front, which is really the beginning of the life cycle of a case in the HCBS Fusion system. That's probably the most important place to have your productivity. You don't want bottlenecks at the very beginning of the process that causes downstream domino effects, creating delays for individuals receiving critical services in their home.
Now that we've launched Fusion here a few months back, we're excited about what the future holds. I see our agency as leading the charge in a lot of ways, especially in home and community-based services, as we're one of the first in the state of Missouri to have modernized our platform. And so we're positioned to be able to set the pace that other agencies can follow along, whereas prior to Fusion, it just wasn't an option. The technology simply couldn't support it.